Social determinants of health. When we think about what makes a person healthy, we often imagine hospitals, medicines, doctors, and exercise. While these are all important, they do not tell the whole story. Health is not just about biology or medical treatment. It is also about the social and economic conditions in which people are born, grow, live, work, and age. These conditions are called the social determinants of health. They shape every aspect of our lives and can explain why some groups of people are healthier than others, even when they live in the same country or city. Social determinants of health include factors such as income, education, employment, housing, neighborhood environment, access to healthcare, social support, and discrimination. These are the background conditions that determine how easy or difficult it is for someone to live a healthy life. For example, a person living in a clean and safe neighborhood with good schools and job opportunities is more likely to live a longer and healthier life than someone who grows up in poverty, surrounded by pollution, crime, and poor access to health services. Income and wealth are among the most powerful social determinants of health. People with higher incomes can afford better food, housing, and medical care. They experience less stress from financial worries and have more time for leisure and self-care. In contrast, those living in poverty often struggle to meet basic needs. They may live in unsafe housing, lack nutritious food, and be forced to work in stressful or dangerous jobs. Poverty also limits access to healthcare, as people may not afford treatment or transportation to hospitals. This economic inequality leads to health inequality, meaning that poor people tend to get sick more often and die younger than the wealthy. Education is another strong determinant of health. People with more education are usually more aware of healthy behaviors, such as the importance of a balanced diet, physical activity, and avoiding smoking or drugs. Education also opens the door to better jobs and higher incomes, creating a chain reaction that supports health. Moreover, educated parents are more likely to raise children in healthier environments and teach them good habits. On the other hand, lack of education can trap families in cycles of poverty and poor health across generations. Employment and working conditions also matter deeply. Having a stable job provides not only income but also a sense of purpose, social connection, and structure. However, when people face unemployment, low wages, or unsafe work environments, it affects both their physical and mental health. Long working hours, workplace stress, and job insecurity can lead to anxiety, depression, and even chronic diseases such as heart problems. In contrast, fair working conditions, supportive management, and work-life balance can contribute to a healthier and happier life. The environment where people live plays an equally important role. Poor housing, air pollution, contaminated water, and lack of green spaces all have direct effects on health. People who live in overcrowded areas or near industrial sites often face respiratory diseases and other health problems. Safe housing and clean surroundings, on the other hand, reduce the risk of illness and promote physical activity and mental well-being. Urban planning and environmental policies therefore have a huge influence on public health. Access to healthcare is an obvious but still unequal factor. In many societies, healthcare is a privilege rather than a right. People living in remote or underdeveloped areas may not have hospitals or doctors nearby. Even where facilities exist, cost and discrimination can stop people from seeking help. Health systems that are fair and inclusive, providing affordable and quality care for all, lead to stronger and healthier societies. Social relationships and community support also influence health. Humans are social beings, and isolation can lead to poor mental and physical health. People who have family, friends, and community networks to rely on are better able to handle stress and recover from illness. Supportive relationships can improve mood, promote healthy habits, and increase resilience. In contrast, loneliness and exclusion can lead to depression and even shorten lifespan. Discrimination and inequality also shape health outcomes. Racism, gender bias, and social exclusion can create stress and limit opportunities for certain groups. For example, women, minorities, or people with disabilities may face barriers in employment, education, or healthcare. This structural discrimination leads to health disparities that cannot be solved by medical treatment alone. Creating fairness and equality in society is essential for improving overall health. Public policies have a huge influence on all these factors. Governments can improve social determinants of health by investing in education, creating job opportunities, ensuring safe housing, providing universal health care, and protecting the environment. When policies focus only on treating illness rather than preventing it, they ignore the deeper causes of poor health. Prevention means building societies where everyone has a fair chance to live a healthy life. The idea of social determinants of health teaches us that health is not just a personal responsibility but a shared social one. People's choices are shaped by their environment, opportunities, and living conditions. If we want healthier societies, we must look beyond hospitals and medicine and address the root causes of inequality. Health should not depend on where you were born, how much money you have, or your level of education. It should be a basic right for every human being. In conclusion, the social determinants of health remind us that our well-being depends on more than just biology. A person's health is built through their everyday experiences in society, their income, education, work, housing, environment, and relationships. To create a world where everyone can live a healthy life, we need collective action to reduce inequality and promote justice. A fairer society is also a healthier one. If you found this explanation helpful, please like this video and subscribe to the channel for more such sociological and educational discussions. Your support encourages us to continue spreading knowledge and awareness that can help shape a better and healthier world for all.